truck drivers are told that they need to rest after a certain period because otherwise they would be putting other drivers at risk, right? It's interesting because the same concept doesn't apply to physicians. Okay, so why did I bring up truck drivers in the 19th episode of Doctors In? Well, in this episode, we are featuring Dr. Valenzuela, who is the chief medical officer overlooking roughly 500 physicians and clinicians. And we discuss whether or not it is more beneficial to have a physician at the executive level making the big decisions in the hospital or the clinical setting. Now back to the clip.
Referrals and all these things we deal with, it lit a spark in me to really try to impact healthcare on a bigger scale. I really still enjoy seeing patients and affecting those patients one-on-one. But now as a chief medical officer, I can actually impact populations and try to drive healthcare in different directions. And that's really how I've slowly lessened the amount of clinical practice that I do, but I still believe in seeing patients. At my core, I'm a physician, and I want to continue to do that.
Yeah, and it is so great to have a physician kind of stepping up into the role of trying to see how the space of business side of medicine looks like. I think it's very important because, we have hospitals, we have clinics, especially hospitals, right? Hospitals, it is a business at the end of the day, right? And in a business, especially in the hospital setting, we have executives and titles with someone who's not a physician,
Sure.
right? And they're making the decisions. And you have a lot of comics, kind of, web comics that are based around that,
Yeah.
right? Was that something that you also saw, which is like, okay, this is something that's lacking, where a physician needs to be there to really show, okay, here's where we're moving the wrong way, which is not patient-centered, like we're focusing too much on the business, or vice versa?
Yeah, no, that's a great question. And it's funny that you say that. I actually recently presented in San Francisco at the Healthcare Burnout Symposium. And my presentation was actually around physician administrator communication. And I used my comics to put some levity to that disconnect that you're talking about. When you look statistically at healthcare organizations that are led by physicians as their CEO actually have quality scores that are 25% higher than other organizations that are not, as well as higher engagement and satisfaction from the staff and clinicians within those organizations. And I think, unfortunately, there's not a lot of physicians who have had that business background that can actually sit at a table and have that administrative speak, to talk with non-clinical people. And it's getting better, though. But I think that there's still a ways to go. And like you said, there's an adage, if you're not at the table, then you're probably on the menu. And we as physicians have had things done to us versus being at the table to try to work with people to say, hey, is this the right thing that we're doing? There's statistics that show that only 16% of healthcare organizations consider the impact to the well-being of the staff being affected when they make strategic decisions. And I think that we need to change that. We really need to change that paradigm and have the right people at the table that can make the best decisions, not just for the business, but also for the patients and the staff and everyone else that's involved in the healthcare system.
Burnout, it is a indirect byproduct of not having a physician at the administrator level, because you are overworking these physicians, especially residents, right? 80 hours work week, which is intense, incredibly intense, to consider that, hey, we have truck drivers and they are told that they need to rest after a certain period because otherwise they would be putting other drivers at risk, right? It's interesting because the same concept doesn't apply to physicians, because physicians are taking care of patients, right? But they're burnt out, they're tired, they're running on coffee, quote unquote, like zombies. And if you enjoyed this short segment, please like the video and comment any feedback. Also, feel free to check out the full podcast episode where we try to ask the right questions to deconstruct study strategies, useful habits, constructive failures, and life lessons. The podcast can be streamed on all platforms.